Hello everyone, I am Dani Ahmed Danihani. I had a master's degree in critical care from School of Nursing at the University of Jordan. Also, I am a teaching assistant and PhD student at the University of Jordan. Now, I want to talk about my research from my master thesis. It talked about the patient's experiences in the intensive care unit in Jordan. Also, I want to mention that it had published at Nursing Forum Journal for any further readings on this topic in details. The experience of critically ill patients in the ICU is considered as an essential indicator of the quality of healthcare. The ICU environment can cause a high levels of anxiety and restlessness for the patients. Patients' experiences mainly depend on the care provided by the healthcare provider. Most patients discharged from the ICU have psychological problems such as hallucination, delusion, nightmare, anxiety, depression, and memory loss. Evidence-based articles found that an increase in negative patient experiences in the ICU could be caused by nurses who misinterpret experiences or do not realize these experiences. The improvement in the experiences could improve the patient's health and reduce the cost of care for the patients and for the hospital. The identification of the ICU stressor can allow caregiver to provide better care and increase patients' comfort and well-being during and after periods of ICU. The purpose of the study was to describe the experiences of Jordanian patients during their stay in the ICU and to explore the associated factors. The study was used a descriptive correlational design and was conducted from one of the largest public health care hospitals in Jordan, Al-Bashir Medical City. The intensive care experience questionnaire was used to measure patients' experiences. The patients included in this study were aged 18 years or above, spent at least 24 hours in the ICU, able to give informed consent, and can speak Arabic or English. The patients who excluded from the study who had cognitive impairments because that could affect the patient's ability to provide valid and reliable information about their experiences and who refused to participate. A structured interview was used to fill in the intensive care experience questionnaire to assess the ICU experiences. The result of the study include 161 patients who met the inclusion criteria, but 11 of patients who refused to participate, as a total of 150 patients who were transferred from ICU and included in this study. 60% of the patients were males with a mean age of 44.5 years. Length of stay ranged from 1 to 31 days. As a result of intensive care experience questionnaire, including 85.3% of patients were glad to be transferred out of the unit, 50.7% of patients being unsure as whether it was a day or night in the ICU, 58.7% of the patients reported being in pain during their stay, 17.3% of patients reported having bad dreams, 84.7% of patients reported being aware of someone near to them, and 12.7% of patients reported seeing strange things during their stay in the ICU. Also, there was a correlation between length of stay and the frightening experiences, and there were a negative correlation between the length of stay and the awareness of surrounding and satisfaction with care. Also, there were a positive correlation between sedation in ICU and the frightening experiences, and negative correlation with the awareness of surrounding and the recall of experiences. In conclusion, a higher negative experiences were associated with longer length of stay and using of invasive mechanical ventilator and sedation. 49.3% of patients reported blurred memories of ICU due to receiving sedation or deterioration in their level of consciousness. The critically ill patients could be unaware of their surrounding as a result of several factors such as disease progression, pain, poor communication, or received sedation during their stay in ICU. 46.7% of patients found ICU to be very noisy, and most common source of noise from nurses and physicians' activities, alarms, and family visits. Limitations for this study were the presence of the researcher during structured interview may have affected the participant responses. Some of the patients were lost to follow-up due to data collection was conducted during the COVID-19 pandemic. As a recommendation for further studies to assess the association with negative positive experiences with the severity of illnesses and patients' outcome. At the end, I would like to thank all of you